Good evening. I am Trudy Olson Curtis, and I'm here to share some valuable information with you tonight. The workshop tonight is going to be about STD prevention. So let's get started. I'm going to share my screen with you. Okay. Yes, so STD prevention, a very important topic tonight. I'm glad you decided to join me. So STDs, there are many types of STDs, and they're caused by bacteria and viruses. They include diseases such as gonorrhea, syphilis, HIV infection, chlamydia, genital warts, and herpes. And the viruses and bacteria that cause these STDs are usually found in semen, vaginal fluids, and the blood of an infected person. A person can have more than one STD at a time and can get an STD more than once. So I hope none of you are in that situation, or that you're getting treatment if you are. Many young adults who have vaginal, oral, or anal intercourse will become infected with an STD. In fact, currently there are 200 million STDs annually in the United States. Anyone, regardless of age or sexual orientation, can get STDs if they have sexual contact with an infected person. So the major symptoms of most STDs include genital discharge, sores on the genitals or mouth, abdominal pain, painful urination, skin changes, genital itching, or a sore throat. But the problem is a lot of these symptoms can be hidden or absent, especially in women. You can't determine who has an STD just by looking at that person. And the only way to know for sure if someone is infected with an STD is by getting tested and having a medical examination. Individuals suspecting that they have an STD should stop having intercourse, promptly get tested, and tell their sexual partners. So places to get counseling and STD testing are private doctors, family planning clinics, hospitals, and Planned Parenthood is an excellent place to get all of these services. So STDs, like I said, can be detected through blood tests, urine tests, or vaginal, penile, or throat swabs. And when you get a routine medical exam, they do not typically check for STDs. So you have to really specifically ask your health provider for an STD test. And persons infected with STDs should definitely encourage their partners to seek medical care. Individuals should discuss their concerns about STDs with their sexual partners. And partners can reinfect each other with an STD unless both get proper treatment. So it's really good to get tested with your partner. But an uninfected couple can avoid STDs by practicing mutual monogamy. So untreated STDs can lead to serious health problems, including infertility. So they can become really serious if they go untreated. But proper use of a latex condom, along with water-based lubricants, can greatly reduce but not eliminate the chance of getting an STD. And dental dams, latex barriers used during oral sex can reduce but not eliminate the risk of STD transmission. So now I'd like to share with you a little instructional exercise on how to use a condom properly. So I'm just going to move this back a little bit so you can see. So first thing you want to do when you get the condom, you want to check and make sure that it's not torn or expired or too old. You can look on the back and there's an expiration date for all condoms. Right on the back that'll tell you if it's expired or not. So you want to check that first, and then you want to just push the condom down so that you won't tear it. So you're going to take this top part, you're going to go to the serrated edge, like so, and you're going to just tear the package open. Making sure that if you have fingernails or jewelry, just be really careful. And also using your fingers rather than using a knife or scissors or your teeth is the best way to get a condom package open. Okay, now that we've taken the top off, I'm just going to gently remove the condom. Like so. And you'll see when you take it out of the package, there's actually a tip that should be standing up. This is the right direction to put the condom on. So the tip should be coming up because when it rolls, it's going to unroll to the outside. Okay. So this already has lubricant on the inside and the outside. So I'm demonstrating with a cucumber tonight. Okay, so I'm just going to take it. I'm going to put it on. So you put it on the erect penis. Let me screen down a little bit. There we go. And I'm just going to make sure that I hold the tip up as I roll the condom down. Yeah, and just hold the tip and keep rolling the condom all the way down. So it should fit tightly. See how there's no ridges or this is a really good fit. Okay, so afterwards, when after your partner is ejaculated, you're gonna hold the tip of the condom. That's where the semen is going to be, and we're just gonna roll it down. Just gonna push it down, keep rolling it, hold on to the tip because that's where all the semen is going to be. So keep rolling this down. Rolling. And then we're just going to throw that away. Okay, so that was just a quick demonstration on how to use a condom properly. It's really important. Obviously, if it's not used properly, it's not going to do its job, and you would not be preventing STD in that case. So you can help fight STDs by sharing accurate information, being a responsible role model, and encouraging others to protect themselves. And finally, for more STD information, medical services, and counseling, contact Planned Parenthood. They're a great source for information. And locally, there is a Planned Parenthood location at Utah County Health Center located at 1086 North, 1200 West, Orem, Utah. You can contact them at 801-226-5246. Or you can contact me or look at my website, which is stopstds.com. So it's been a pleasure being with you tonight. Thank you so much for your time. And I hope this has been given you some valuable information to use. And take care of yourself, protect yourself, and protect the ones you love. Thank you.